is accelerating fast, maybe even faster than healthcare can handle. But as the old adage says, if you rush, you ruin. So, how can healthcare organizations adopt AI responsibly without breaking what they're trying to fix? Welcome back to the Humanify Health Tech podcast, which is where we explore how AI is rewriting the rules of healthcare and putting people back right at the center where they belong. I'm Francesca Vereb, Head of Marketing at NetHealth, and today we're focusing on the responsibility side of innovation. How do we adopt AI in ways that are safe and transparent and compliant and aligned with real clinical workflows? And how do we ensure that humans use their judgment, empathy, and accountability to remain right in the key part of the loop, just as AI continues to transform care? Now, joining me today is Keavy Murphy, VP of Information Security at NetHealth, an expert on guiding organizations through those complex intersections of privacy, compliance, and AI adoption. She's here to help us understand not just what the risks are, of course, but how leaders can build those systems to protect trust, support clinicians, and also strengthen patient confidence. Right, Keavy, welcome. So great to have you on this podcast today. You do a lot of writing for us and a lot of public speaking. And one of the key things that you've actually done is spoken about the fact that AI is the most exciting and the most versatile technology in healthcare. But you've also cautioned that there's a corresponding risk there that if we don't adopt AI, there can actually be a much greater risk for organizations. So how should healthcare system leaders begin to think about their roadmaps as they plan for AI implementation, not just this year, but also into the future?
Great to be here. Thank you, Francesca, for the opportunity. I always love talking to you. And I appreciate that you highlighted the fact that not adopting AI is really the biggest risk of all. And so it's important to develop a roadmap in any organization, regardless of size, for AI adoption, because if you're choosing to not adopt AI, you're missing out on the opportunity to learn really safe and secure implementation practices. And then down the road, you're going to be forced to catch up under pressure. So that's why it's critical to start thinking about an AI strategy today at your own healthcare organization. And from my perspective, a good AI roadmap really starts with a simple question, which is, where does AI actually solve a problem today that we can't solve better another way?
Such a key point, Keavy, because MIT's research recently actually showed that, the year of 2024, 2025, that sort of late 2024 period, a lot of pilots started. And candidly, 95% of those AI pilots, according to MIT, have not progressed. So what do you think is keeping healthcare organizations from breaking out of that like pilot phase into that real workflow that you just described?
Yeah, that MIT article got a lot of traction and it has some really, really key points that I think are important for all of us to internalize and take a real look at. And one thing that I'm seeing is once healthcare organizations are excited about AI and they're bullish on it, they want to adopt it, they just start to do way too much all at once. So they start kicking off 10 proofs of concepts with 10 different AI vendors, and they start putting AI functionality into every single standard operating procedure they have at their company. And to be really candid, your clinicians, they're already burnt out, they're already overwhelmed. And then you add AI into the mix, and that just adds exponentially more stress for them. So, my guidance is always to not let the allure of AI take you away from the business problem that you're trying to solve. You want to avoid adopting AI just because you feel like everybody else is doing it, and instead just focus on solving one specific problem at a time. So really have an incremental approach.
That's true. And I think when you talk about risks or fears and just burdens on clinicians, another key area of anxiety is also around, this notion of PHI, right? The fact that you have actually described this many times as being the most intimate data about an individual. And so when organizations are thinking not just about clinicians, but also about protecting their clients, their patients, and thinking about those privacy concerns, and with AI and healthcare, obviously there are a lot of tools that are designed to help this, but how should we be thinking about that usage in clinical settings?
Yes, great point about PHI being really intimate, really sensitive. And it's absolutely the only information about somebody that is unchangeable. And that's why it has to be protected to the furthest extent possible. So PHI is data about somebody that they can't reverse, they can't take back. If you think about your financial data, and if it ends up in a data breach or an inadvertent data disclosure, you can always get reissued a new credit card number. If you lose your debit card, you can get a new PIN. But with your PHI, that's something that you typically can't modify. You can't erase a diagnosis. You can't really remove an appointment from your appointment history. And in worst case scenarios, PHI can be used for identity theft. It can be used for discrimination. So that's why it's key to protect it. That's why we have so many rules around it. And that's why it's like we said, the most sensitive data about a person. And that's why it needs to have the most security protection. And something that we're seeing a lot is that AI technology is being developed and it's being targeted towards healthcare companies, but a lot of times that AI technology is not actually built with PHI specific safeguards in it. And so then we, as clinicians, might accidentally put PHI into these tools without understanding the real world harm to that data. And my guidance would be to reduce that risk level, to make sure that you're just procuring from organizations that have HIPAA compliant safeguards built into the AI technology that they're developing, and not just from any AI company that you see in the market. And Gartner does a lot of really good AI specific podcasts. And a recent one that they did just earlier this week highlighted that AI companies are often innovation ready, but not enterprise ready, which I find to be very true here. Is that AI is coming out and it's really innovative and exciting. The technology is certainly something you want to harness if you're in a clinical setting, but you have to be choosing from the right vendors that are enterprise ready.
I think that's a fantastic point. I also think there are certainly some struggles when you talk about HIPAA. It's intentionally flexible, right? But then that also leaves, particularly in the healthcare space, private practices, et cetera, leaves some of these small healthcare companies a little bit vulnerable trying to interpret complex regulations, right? And they don't generally have budgets or expertise in-house to be able to do that well. So tell us a little bit about that impact specifically and some recommendations that you might have for those organizations trying to implement.
Yes, HIPAA definitely was written to be technology agnostic. So it has a little bit of flexibility in the way that it can be adapted to account for things like agentic AI or generative AI. But the downside of HIPAA is that it was written in a way that it includes a lot of very strict security and data privacy rules. And then it provided no support for small healthcare organizations. So they've been really left on their own to be able to meet HIPAA and to align with those HIPAA and security provisions when they don't have enough money. They have really, really small staff, and they also just don't know how to interpret the rules. And sadly, a lot of companies, small healthcare organizations, they're not going to admit it, but there is an opportunity cost to meeting a regulatory requirement, and some companies just simply can't do it. And then they struggle with that cybersecurity hygiene, and then you add AI into the mix, and then it just adds even more security risk. And so while I'm definitely pro regulation because I work in cybersecurity, I love guardrails. I do hope that when HIPAA is amended either in 2026 or 2027, that the security and privacy rule gets altered so that it includes more funding and more regulatory support for those smaller healthcare organizations that struggle with basic cybersecurity hygiene.
Yeah, I think it's a great point. And I think there's two thoughts that come out of what you've just said. The first one I want to talk about is transparency. And then the second one we'll come back to on AI ethics and governance, as you discussed. But the no surprises rule that you've touched on before, and certainly in all the writing that you do for us and for others and your speaking engagements, you've mentioned feels especially human. And you mentioned just a few minutes ago about what type of data clients and patients and providers and folks are sharing. Can you share a real world example of what transparency looks like in practice?
Absolutely. So, in the space of data privacy, we like to follow this best practice called no surprises, which essentially means that when you're giving me your PHI, I should only use it for the explicit purpose that you gave it to me for. So, not using it for any other purpose beyond doing something like scheduling an appointment or filling out your medical chart. So, if you come to me and you give me your PHI and I say I just need it because I need to set up your next appointment with me, I should just use it to schedule the appointment and not then go use that data to do a marketing campaign or to set up a Netflix account for myself or something like that. And in addition to that, when we say no surprises, we also want to make sure that we're never doing anything with somebody's data that a reasonable person would be surprised by, shocked by, disturbed by. And when I think about this data privacy best practice, I find that it really also is very applicable to AI usage as well in a healthcare setting, meaning you should always be very transparent with the patients that you're taking care of. And then if you're in a long term care facility, maybe your residents and their families, about how and when you're using AI in their care. So just asking for consent and communicating openly if you're using any sort of new AI tool within the appointment.
Right. And so then that brings us to the next point. When you're talking about transparency and thinking about that ethics and governance of data, you've also mentioned that having an AI implementation roadmap before just diving in is really important because there is importance around governance, but also, like you said, managing that data and really understanding what that looks like. So when it comes to enterprises, big, large, or anywhere in between, AI ethics and governance really does require that sort of roadmap. So, what belongs in it? Who should ultimately own that? What does it look like? Tell us a little bit about that.
Yeah, roadmap is the first step before you start diving into AI. And PwC did a report earlier this spring, and they said that about 57% of business executives feel like they're missing out on opportunities because they can't make decisions fast enough. And I am confident that they were talking about AI when they were interviewed there as part of that report and that study. Because, like we said, people are afraid of missing the boat on AI and they're rushing in without a clear strategy or a roadmap. And then you have no governance. And what happens there is that that just leads to a lot of very expensive experimentation as opposed to doing anything of any real business value. And that worries me because in security, if you don't have a roadmap or governance, it's very easy for data privacy issues to multiply. So in terms of avoiding just doing a lot of experimentation and not actually getting anywhere with AI, I would always just start by asking myself and my teams and then any other stakeholders, what business problem are we trying to solve today that we genuinely cannot address with any of our pre-existing tools or processes? That should be question one. And that'll open your eyes a little bit to what you can use AI for. And separate from that, I also want to highlight that it's really important for an organization as they build an AI strategy and roadmap to not just limit looking at AI use cases just through the lens of how it can help with cost cutting measures and efficiency. Obviously, those are two really, really useful things. And it's mostly why people want to get on board with AI is because they think it's going to save them money and time. And it is. However, you're limiting yourself and your organization if you just think that those are the only two things that AI can do for you. And not to be cheesy, but I would encourage people to dream big and to get creative and to try to think of other ways that AI can be used in their own organization, because also they're going to miss out if they don't. If you just look at it through a very narrow lens, you're going to miss out on a lot of really great things.
Yeah, it's such great advice because it's typically what we're seeing is folks are building AI on top of a faulty infrastructure, looking at using AI to solve various workflow problems. And on the surface, that seems great. But to your point, if you haven't really done that roadmap, really done the due diligence, really, asked those key questions about what are we actually trying to achieve, I think that does break the system, right? Because you're just building, it's like the poor foundation from a house and the cracks will start to appear. And one thing a lot of experts are throwing out there as being the solution to that is this notion of keeping a human in the loop, which we do understand is important and certainly will help. But from an AI governance standpoint, what does that really look like day to day, particularly for clinicians, for data teams, etc.?
Yes, a fantastic best practice, keeping the human in the loop, checking work. And when I think about it from a clinical standpoint for clinicians, I would advise that AI really handle the manual, repetitive work that doesn't require a lot of critical thinking or care reasoning. So if you can delegate to AI things like filling out a form, scheduling the next appointment, taking notes, data entry, documentation completion, that's a really good way to position AI because then that frees up the clinician to focus on the things that AI can't do. So at this point in time, AI cannot display empathy. It cannot develop rapport with a patient in your hospital or your waiting room. It also cannot show bedside manner. And it really, most importantly, can't look a patient in the eye when they're receiving a difficult diagnosis or dealing with a really hard medical issue. And that is something that is uniquely human. So if we can have this separation of duties where AI handles the manual, repetitive, paper heavy work, it will allow the clinician to focus on those uniquely human things that are a part of their profession and are really the bedrock of having good healthcare.
Yeah, that point particularly resonates with me. I had a circumstance with my daughter. She's still going through a lot of healthcare challenges, and so having to work and sit in front of a bunch of different, surgeons and practitioners and providers, and not being able to have that eye contact. I think that's a really key point, and it certainly meant a lot when we had those folks who had and displayed that bedside manner. And so I think the key point there is the technology needs to become invisible. It needs to support. It's an accelerant to those clinicians, is what you're saying, and take the burden off with all that administrative work, which I think is spot on. Well, there's a point there as well. If we start to think about, you said over reliance, I think was some of the key areas that you were touching on, but we've all used LLM models and we've all used some version of AI, right? And sometimes those answers can appear overly confident, but in a medical circumstance, that can be really dangerous. So how do we help health organizations avoid that over reliance on AI? What is the guidance that you give from your perspective?
It definitely goes back to what we were just saying about keeping the human in the loop. And I like to see AI as being something that should be a tool in the toolbox, but it should never be something that we operate completely hands off with. It should be a reference point for anyone working in a clinical setting. And I would advise any organization that's adopting AI today, as as they kind of develop that roadmap and they start implementing those tools that you said should become invisible. It's important to treat AI kind of like a new smart assistant that you just hired. So they're very excited. It's their day one. They have a lot to learn, but they're really happy to be there and to start helping out with those manual tasks. You should start delegating things to it incrementally, like we said, that are things like appointment scheduling, documentation completion, filling out a form, etc. And like I said, thinking of it like an assistant. So when you hire in a clinical setting a new intern, you probably don't give them all of your tasks and all of your work on day one and then give it over to them and just say, good luck, hope it goes well, and then walk out of the room. You would give them tasks incrementally, verify their output, check their work, make sure that they're doing everything correctly, and then over time delegate more and more tasks to them while continually verifying its work. That's exactly what you should be doing with AI, is to just, like we said, incrementally give it tasks to complete, verify its output, but don't operate completely hands off and let go of your critical thinking and your care reasoning and your judgment and your expertise. Those still play a role here. AI is just a tool in the toolbox.
Totally. That is spot on. And I do think that people are starting to learn, maybe some from some failed experiments, maybe some have had a couple of tough lessons to learn. But I think as we're all adjusting, not just the healthcare space, but all industries, that is certainly a really key point to keep in mind. One of the key things that you also help us with is you help us evaluate a lot of technology. So for us, for the marketing org, you're honestly always looking at the MarTech stack that we've got in place. What sort of data and privacy are we touching? But you also help a lot of the vendors when they're making their decisions for, AI compliance, just the claims that you start to see out there. And oftentimes on marketing materials, we see this word of, hey, I'm HIPAA compliant. Is this truly something that people, is there a certification there? Is there some credibility, or is it just marketing fluff? Can any vendor put that claim out there? What do you as the expert test for when you're evaluating vendors for organizations and making recommendations for our clients when we're looking at integrations and other types of tools?
Yeah, you make a great point. I mean, how do you identify if this is really just marketing fluff? I mean, HIPAA compliant, it's very easy for an organization, an AI vendor, to put a pretty badge on their website and say, we're fully HIPAA compliant and you can trust us. I always advise people, though, as a security professional, never take an AI vendor at their word. Make them prove to you that they do what they say that they're doing when it comes to security and data privacy aligned with HIPAA, because you can put a badge on your website and it'll take a second and people might never question you on it. But if you're trying to evaluate whether you can trust a new AI vendor, I would typically ask for three things. Number one, I'd ask them to provide evidence of their most recent HIPAA risk assessment. An executive summary works. And then I'd also ask them for their latest SOC 2 report or any sort of equivalent security audit report. And I'd also ask them to sign a business associate agreement with me. And those three documents typically can give you a good indication of whether or not a vendor is truly HIPAA compliant. But again, make them prove it to you. Don't just take their word for it. The stakes are
That
too
is
high.
gold. That's gold. Great advice. Thank you so much for that. And I would agree with you. I think even depending on, like you say, different expertise, those are three very simple documents or tests that pretty much anybody can leverage, right? So, yeah, fantastic, really great advice. Okay, let's flip the script a little bit and let's start to shift more into sort of a forward-looking view. I'm going to ask you probably a little bit of a tough question here, but we in healthcare are constantly under this pressure to adopt AI, right? Marketing in my department, it's pretty much the thing that we talk about every day, multiple times a day. How can we use it for efficiency? How can we use it for innovation? But the same is true in literally every role across the organization, from sales to client support to product, you name it. What is the realistic security challenge that no vendor is actually solving today? And obviously focus more in the healthcare space, but how are you thinking about managing that gap in 2026?
The biggest, most critical, most serious security risk when it comes to AI is the exact same one that we've seen ever since generative and agentic AI entered the market. And it's the fact that AI is really difficult to secure because it requires human provided input. So if you want to use an AI tool, you have to type some text into it. And what I mean by that is you can't leverage these tools without asking them a question or entering a query. So for example, ChatGPT, Copilot, any of these tools, in order to use them, you have to type something into it. And that same text that you're entering, it also could contain malicious instructions. It could contain a terabyte of PHI belonging to patients that you should not be entering into these tools because it puts the patient at risk. But the only way to eliminate that security risk entirely would be to just not use any AI tool ever, which, as we said at the beginning of today's conversation, that is the biggest risk of all. We don't want to opt out of using AI. So if there is a organization or a person that can solve that security challenge in the healthcare space, because it is very relevant to healthcare, as you said, there's no industry that's not touched by AI, but because we are dealing with the most sensitive data, we have to take this security risk much more seriously. So if there is, like I said, an organization that is able to solve that security challenge in 2026, they're definitely going to be getting the most news attention. But I'm not holding my breath that that's going to happen. So instead, I would say that it's really on us here at NetHealth, of course, to develop secure AI products and to continue offering those in the market so that people know their PHI is safe and protected. And in addition to that, it's also those working in a clinical setting to make sure that they're procuring from vendors that are building defense in-depth security controls to the AI technology that they're offering.
Spot on. Great advice. And Keavy, let's end here on this particular note. But if you could give one piece of advice to healthcare leaders trying to balance innovation and compliance in this new age, what's that going to be?
Definitely want to be able to balance both. We want to be able to hold both of those two concepts at the same time in order to enter the future. And there's definitely a lot of energy in the market with small startups who are pushing AI into absolutely every healthcare platform. We said that a couple of times today that that's a trend. And definitely that can be exciting because it can seem really innovative, but then we're putting at risk PHI because these organizations are new. They don't really have a lot of robust security controls for their AI technology. So to reduce that risk, I would suggest two things for an organization. Number one, I would say try to continue to work with technology vendors you trust. So if you're already working with a software vendor that sells healthcare specific products and they are adding in new AI functionality, continue to work with them because that's typically a long-standing relationship and you've developed some trust there and you understand how their technology works already. And the second thing that I'd also suggest is to make sure that whatever AI vendor you're working with in the healthcare space or you're doing a proof of concept with or a pilot, make sure that they didn't just start doing AI yesterday. Usually, as we said, there are new types of AI emerging, generative and agentic obviously being the most popular, but AI as a functionality has been around for years. And there are plenty of healthcare organizations out there that are offering technology where the AI is not new. It's not something that they just started when the hype cycle really began in 2023 and 2024. So I'd advise looking to those organizations. Selfishly, from a security perspective, it typically means that they've had a lot of time to build in proper defense in-depth security safeguards to the AI technology that they're offering. So that is why I would advise you to work with them if you're looking to balance innovation and compliance.
So what you're really saying is the fundamentals of good business, good ethics, making sure that you're doing, sound business principles. Just because we've got this amazing innovation and buzzword, AI floating around, doesn't change those fundamentals. So that's fantastic, Keavy. I could honestly talk to you forever, but we're unfortunately out of time. So what I'm going to do is just wrap up with a couple of key takeaways. You made some fantastic points today. The first of which is that responsible AI is more than just a technical challenge. It's that distinctly human one, right? So we need to make sure, again, trust the human involvement there. Protecting PHI and ensuring transparency and keeping clinicians actively involved is really foundation to all the best practices here for healthcare. That's going to help us continue to earn and keep trust. And good governance isn't bureaucracy. It's really just what makes safe innovation possible. And again, thank you, Keavy, for all the great advice that you gave to our listeners today. Thanks again for joining us, Keavy. And thank you to you, all of our listeners. If you're tuning in from Spotify or YouTube, we'd love to hear your thoughts on this episode in the comments below. And once again, I'm Francesca Vereb, Head of Marketing here at NetHealth, and I'll see you next time.